Hi, this is Johanna Belazaire presenting the Carcinoma of Cervix case study. A 33-year-old lawyer who postponed pregnancy in her 20s has been trying to get pregnant for several years. Her husband had a son during a prior marriage. She goes to her gynecologist for workup of her infertility. Her history includes menarche at age 12, cold arch at age 15, 8 sexual partners in her lifetime, cyclic menses regularly every 28 days, no birth control for 2 years, no pelvic examination in 5 years, and she reports no intravenous drug use. Physical examination includes friable vascular lesions on anterior uterine cervix, a pap smear diagnosis of high-grade squamous intraepithelial lesion, human papillomavirus assay positive for high-risk HPV serotypes, cervical biopsy diagnosis of severe dysplasia with flat condyloma, blocked non-patent fallopian tubes on hysterosalpingogram, microimmunofluorescence test on cervical mucus positive for chlamydia trachomatis, and a negative HIV test. The first picture shows what a normal cervix looks like. Then it shows low-grade cervical intraepithelial neoplasm. Then it shows a high-grade cervical intraepithelial neoplasm and what cervical cancer looks like when it's full-blown. The second figure shows what cervical looks like on a cellular level, and the last one is the effects of chlamydia on the fallopian tubes, on how it blocks the fallopian tubes if it's asymptomatic and untreated for a long time. The first research article is entitled Human Papillomavirus Genotypes in Invasive Cervical Squamous Cell Carcinoma in Trinidad. So this study was done in Trinidad, and it was conducted to determine the relative contribution of known high-risk HPV genotypes to the occurrence of cervical cancers in Trinidad. This was a follow-up study to an investigation of HPV genotypes in 310 non-symptomatic women in Trinidad. The results include HPV DNA was successfully amplified from 78 of the 85 invasive cervical squamous cell carcinoma. A definitive HPV genotype could be determined for 56 of the HPV positive specimens and the other 22 having indeterminate HPV genotype. Most common HPV genotypes found were HPV 16, which accounted for 37 out of the 56 of the positive specimens, and HPV 18, which accounted for 10 of the 56 positive specimens. HPV 16 and 18 together were associated with 83.9% of the cases of invasive cervical cancers analyzed. As much as 90% of detected infections were cleared within 2 years, especially for infections in women 25 years or younger. Progression of cervical HPV infections to cancer occurs in cases of persistent infections. In conclusion, despite marked heterogeneity in high-risk HPV genotypes among the general population, the two high-risk genotypes, HPV 16 and 18, are most frequently associated with cases of invasive cervical cancers. Findings also support that these two high-risk genotypes are more prone to persistence and progression to cervical lesions compared to other high-risk genotypes. Going back to the case study, it was said that the patient was positive for the high-risk HPV serotypes, although it didn't specify which one, but it's important to note. The second research article is entitled Clinical Pathological Importance of Papa Nicolau Smears for the Diagnosis of Premalignant and Malignant Lesions of the Cervix. So the study was done in Pakistan. to determine the clinical pathological importance of conventional pap smears for the diagnosis of premalignant lesions of the cervix. The results included pap smears of 1,000 women ages 20 to 70 years old were examined from January 2007 to June 2009, with only cases of neoplastic cytology being included. Out of the 1,000 examined pap smears, 102 smears showed premalignant or malignant changes. Among the 102 cases, 62 patients were of postmenopausal age, 45 patients were of low socioeconomic status, 57 patients had history of early marriage, 69 patients had a history of multiparity, 93 patients had complaints of vaginal discharge, 15 patients had used oral contraceptives, 7 patients were smokers, and 7 had a history of abortions. Only 9% of the women had a pap test within the previous 5 years, and 91% said they had never had a pap test. Early marriage and multiparity were common risk factors, and low-income women were found to be at high risk for developing cervical cancer. In conclusion, the pap test is an effective screening tool for neoplastic gynecological diseases such as cervical carcinoma. Going back to the case study and our patient, it was said that she's a 33-year-old lawyer, so it can be assumed that she is not of a low socioeconomic status. However, whether it be lifestyle factors, being too busy to have regular checkups with doctors, or just simply lack of awareness of the importance of pap smears for preventative or screening as a screening tool to prevent cervical cancer or detect cervical cancer so it doesn't progress. It can be said in her case that maybe she just wasn't aware, as opposed to women who, don't have the means to visit a gynecologist regularly or follow up on abnormal pap tests. The third article is entitled Serotypes of Chlamydia Trachomatis and Risk for Development of Cervical Squamous Cell Carcinoma. HPV DNA-based cohort studies have confirmed that past HPV infection predisposes women to developing cervical carcinoma. Longitudinal seroepidemiological studies have provided evidence that Chlamydia trachomatis infection is an independent risk factor for the development of invasive cervical squamous cell carcinoma. This study was done to determine the association between exposure to different Chlamydia trachomatis serotypes and subsequent development of cervical squamous cell carcinoma. The results show that 128 women who had developed invasive cervical squamous cell carcinoma at least 12 months following serum donation were examined. And of the specific chlamydia serotypes, serotype G was most strongly associated with squamous cell carcinoma. Increasing numbers of exposures to different chlamydia serotypes also increases risks. In conclusion, the results showed that there's a link between past chlamydia trachomatis infection and cervical squamous cell carcinoma. Going back to our patient, she was positive for chlamydia trachomatis. So this article kind of sheds light on how, depending on the serotype, that there's a link between that infection and cervical squamous cell carcinoma. It's also another thing to note that undetected chlamydia infection that's been inside the body for a long time and untreated can also be a cause of her infertility, which is one of the reasons why she went in for a checkup in the first place. So in addition to it being a risk factor to cervical squamous cell carcinoma, it also contributes to infertility, which is something else that our patient had a complaint of. or is experiencing.
Hello everyone. Joanne, there is the article in your presentation that talk about research study conducted with Trinidad and Pakistan women. And I found a research article conducted here. It's called Disparities in Cervical Cancer Screening Between Asian American and Non-White and Non-Hispanic White Women. It is believed that Asian American women had a lower rate of obtaining a Pap test, 70%, than non-Hispanic white women, 81%. And the reason why it's belief in cultural differences play a key factor on delaying screening. A couple of them is disparities in access to care, lack of health insurance and regular provider than non-Hispanic white women. Women who does have providers are not satisfied, talking again about Asian American women, and feel like providers do not listen and understand the cultural background. And also they do not involve them in medical decisions. So in conclusion, what needs to be done is education. Education is needed to both Asian and providers. Yes, as providers, we need to recognize cross-cultural differences in healthcare to enhance their competence. Engage with minority women during medical encounter. Thank you.